The stress on frontline staff at hospitals is taking its toll on many of these brave folks, and now there is a resource to help the heroes. I'm joined by Dr. Sharon Kiely. She is the Chief Wellness Officer at Hartford HealthCare. Thank you so much for being with us.
And thank you for having me. I'm delighted to be here.
You have this new colleague support line. Tell us how it works and why you think it's so important that your staff take advantage of it.
This helpline is a dream come true. The resources that we have at Hartford HealthCare are extraordinary. But what we recognize that especially during the surge, but what we know to be true even longer after the pandemic is completed, that our healthcare folks really do need support for the long term. So what we did in a one-call center is identify the things that were most on their mind and also those things that they most needed. And I'm happy to talk about what those are.
Yeah, some might not even know they need help, or they might think it's a sign of weakness to call for help. How do you really get your tough nurses and doctors to call in, and what's available for them?
Oh, absolutely. So we went about this in two ways. We started to think about what are those things that are most important in everyone's lives. Really, childcare, elder care, housing. If you were afraid to go home, for example, after working in a COVID unit, or being exposed to patients with COVID, and perhaps you didn't want to go straight home, we had help at hospitals. Also for our redeployed staff, we had hotels close to those hospitals so that they could spend the night there, get a shower and refresh before going back to work without having to travel a long distance back to their home. So there's some basic needs that we really focused on: food, groceries, childcare, housing, those things that are basic, that were so disrupted during the surge in particular, but continue, as you know, as this pandemic continues. And then for emotional support, spiritual support, and grief support, there is a level of grief right now that healthcare workers have never experienced in this country. More similarly, you might see in areas of pandemic or outbreaks in other countries. But in the United States in particular, we've really been relatively spared. So this is new. So what I would say to those healthcare workers is this is natural. You can expect to feel trauma. You can expect to feel sad. You can expect to not really understand why you're feeling this way. And so what we have put up is a single call line for people to call in and say, I'm feeling this way.
Yeah.
I'm not quite sure how to process those feelings, and we will help you.
Doctor, thank you so much. What is the hotline number, just so we can make sure we put it out for people?
I was told not to.
Oh, okay. So it's within, that's okay. And this part, we can always edit this for later.
Cut this out.
So,
yes. Okay.
So the folks that need it, they know the number.
Yes, the number is on posters, business cards, and they're being distributed throughout all the system this week. And what's most important is we thought it would be really important to give individuals a postcard. Postcard is being mailed out to 30,000 of our colleagues this week. Will go to their home. So when they have a quiet moment and they're sitting with their family, they can consider what help they and the family need and make that call 24/7.
All right. Last question briefly. How many calls have you received and what's the feedback been?
So we started on April the 15th with sort of a slow start as we were training the staff and bringing on new services. And right now we've had about 200 calls.
Good. It's a start. We appreciate your time.
Start.
Yeah, thank you so much. I hope everything works out.
Thank you.
Thank you.
I hope it does too. I'm confident we will. Take care.
Thank you too.